With 101 positive cases in a single day and 546 persons in isolation, tough decisions are needed. Do we pause or crash? The public ought to know whether this outbreak is due to community spread of the Delta variant. Other factors suggest that we may be crossing an unpleasant threshold. The Chief Medical Officer recently advised that a workplace guidance protocol was being discussed with the social partnership. It is hoped that with these protocols, businesses will no longer subject their employees to unnecessary testing, thereby placing a burden on the testing facilities. Are we operating close to capacity with the testing and running the risk of further backlogs? The president of BAMP provided other warning signs. She stated that tougher measures are needed to avoid the risk of overrunning the country's health services. We have learned that the ICU capacity at Harson's Point has increased from 38 beds to 80 beds. In addition to Blackman and Gollop, we now have 4 other schools being used as tertiary isolation facilities. These increased facilities will require doctors and nurses and other staff to operate. Does the Ministry of Health have the healthcare personnel to stretch across these facilities while meeting the demands of the general public in non-COVID healthcare facilities? It may be time for the Prime Minister to make the decision just as she did on the 29th of January 2021 when she declared that she was not willing to sacrifice Barbadian lives to stabilize the economy, and we should pause for a cause. The country needs a heart-to-heart conversation with the Ministry of Health. Once again, it is necessary to take Barbadians into your confidence and thoroughly explain the figures in the daily dashboard so that the gravity of the situation hits home for the entire country. We need a proper breakdown of the figures, separate imported cases from local cases so that we have a better picture of the community spread. Separate the tests for travelers from testing due to contact tracing and walk-ins. This would provide a better grasp of the positivity rate. Why are we no longer reporting the number of persons discharged daily? Consider breaking down the cases into categories: moderately ill, severely ill, and critical, as is done in Jamaica. For transparency, it may be useful to number the positive cases who are vaccinated. This may have implications for necessary changes to the quarantine periods in our travel protocols. If the government wishes to have greater compliance, they should start to teach Barbadians to interpret the data from the science which they are following. The Democratic Labour Party believes that increased vaccination will help to reduce the spread of the virus and improve outcomes. The vaccination rate depends on the availability of vaccines and speed with which healthcare professionals can get them into the arms of willing persons. Currently, 35.6% of the population is fully vaccinated, and we are vaccinating on average 1,275 persons a day. At this rate, it will take another 46 days to vaccinate 10% of the population. This still does not put us close to herd immunity. It may be best to control the things we can and take a pause before the Delta variant causes us to crash. This is Andre Worrell, Vice President of the Democratic Labour Party, candidate for St. John, and spokesperson for health, water, and sanitation.